This is a 53-year-old female patient with hormonal symptoms and a history of heavy menstrual bleeding. Let's jump right into this. What we did for this patient is we did some labs. Her DHEA, blood DHEA level, DHEA is a precursor to testosterone. Her blood DHEA level was okay. It was at the high end. I've mentioned in other videos that if your DHEA is high, it could come from some skincare products. So read the ingredients and all the stuff you're using if your DHEA is high. They did a complete blood count, testing for anemia, testing her red blood cells, white blood cells. So total white blood cells were good. Total red blood cells were good. So she's not anemic. Her hemoglobin is good, which is the protein inside of red blood cells that carries oxygen around. That was good. Likely in the past when she was having the heavy bleeding, these were probably way low. I don't have those results, but these are all good. The size, MCV is the size of red blood cells. That's good. MCH is average hemoglobin. This is the variation in sizes of red blood cells. If platelets were good, they were normal. And then the percentage, they break down the type of white blood cells here. The percentage of each one was good. I prefer seeing the absolute values when we're looking at the breakdown of white blood cells, but all those looked good. Good. Eosinophils, basophils, good. Good. So then we get into the metabolic panel, and we can see right off the bat a little bit of metabolic dysregulation. Now, they didn't mark on here whether or not she was fasting when she did this. If you're not fasting, if you just ate something and you get your blood work done, and they're testing your blood sugar, which is the glucose, it's going to come up high. I'm going to assume that she was fasting because most folks are told to fast. So this is a high blood sugar. And I've previewed these, so we'll see in a minute a test called the hemoglobin A1C. But her blood sugar was high, so there's some metabolic dysregulation already, which could cause inflammation, could cause increases in triglycerides, could cause increases in cholesterol. Blood urea nitrogen, BUN, is a breakdown product of proteins. When you eat proteins in your diet, they break down, and that was normal. Creatinine is what we use to measure kidney filtration rate. Her creatinine was not elevated, so we could assume, and we could see it here, they do a calculation, that her kidneys are filtering well, and this estimated glomerular filtration rate of 104 is like very good. And then all these electrolytes, sodium, potassium, chloride, are also a measure of kidney function. So that's good. Serum protein is good, albumin good. And then we get to alkaline phosphatase was good. If this is elevated, it could be an indication of tissue damage, usually coming from the bones, could be coming from organs too. Hers is normal. AST, same thing, indication of tissue damage. If it's high, hers is normal. ALT, also same thing, and usually this is more specific to the liver. So if this was elevated, which we see quite a lot, there's kind of like a silent epidemic going on called NAFLD, non-alcoholic fatty liver disease. But her case, it looks good. Liver's good. Total cholesterol is good. Her triglycerides were borderline high, and it's probably because she has high blood sugar. The sugars in the bloodstream will convert into triglycerides. Her HDL cholesterol, high density lipoprotein, that is very good at 51. This is protective to your arteries. It's cardioprotective. It scoops up the low density lipoproteins, which we'll see here. This is very low density. These are would be like the really bad. There's no real good, bad cholesterol is good. It's the carrier proteins that are the issue here that could cause oxidative damage, and that could incorporate inside the cell wall, in between the cells that make up your arteries, and cause the formation of plaques. It's the carrier protein. So these lipoproteins, very low density lipoprotein, The cholesterol is healthy. You need cholesterol. If you didn't have it, you'd die. You need cholesterol to make your hormones. You need cholesterol to help with communication between inside and outside of your cells, especially neurons. So VLDL was good. And then the low density lipoprotein was actually good too, 101. You can see the range, 100 to 159. So this is really good. She's okay. Not a major cardiovascular risk there for her. Now, they did the LH-FSH. LH, they don't have the reference. Did they have reference range here? LH. They don't have the reference range, but I think this is a little high. I know for sure the FSH, follicle stimulating hormone, is high, which is, like I said before, indicative of perimenopause. So those were elevated. And here we go. Hemoglobin A1C. This is the average blood sugar over the past 3 months. This was elevated at 6.1%, almost in the diabetic range. So this patient is technically pre-diabetic, which this information is good to know because it kind of like is a wake-up call, because this could be changed with lifestyle modification, mainly eating less, like separating yourself from this culture we've been in our entire lives of eating so much and starting to eat less, and then exercise more. When you exercise, those muscle cells will take the sugar out of the bloodstream and pull them inside of those muscle cells so that you're not having elevated blood sugar. So she's pre-diabetic. We also call this insulin resistant. So she has insulin resistance, meaning because of the metabolic dysregulation, when she eats a meal, specifically carbohydrates, those get broken down into glucose. That raises the blood sugar, the blood glucose. The pancreas releases insulin into the bloodstream, and that insulin helps to take that sugar and that glucose and put it inside of the cells instead of outside in the bloodstream. For people who have insulin resistance, the cells, even though insulin is there trying to tell the cell to open up, the insulin is like a key. It goes to the cell, unlocks it, opens it up, and the sugar goes inside. With insulin resistance, the cells are no longer responding to insulin, which is no bueno, and you end up getting high blood sugar, which sets you up for a situation where you could become diabetic once this goes to over 6.4%. So we're watching this. I'm definitely adding some help in the plan for that. They tested estradiol. This is going to be free estradiol plus bound estrogen. So estradiol. So it's not giving us a good picture of what her actual usable estradiol. You can get free estradiol only tested through a blood test, but it's more expensive. I always do the saliva test because the saliva test only tests the free form of the hormones, and it's more cost effective if someone were to pay cash for the labs compared to if they were going to do a blood test. And they also did a stool test, see if there's blood in her stool, and that was negative. And then that's it for that. Let's hop on over to the salivary hormone results. Cortisol is one of those hormones that regulates your circadian rhythm, so it could get thrown off a little bit. She's not frankly low. Frankly low is in the dark blue. She is in the suboptimal range. We really should see it up in the green, but that's it for that. This could also be due to a maladaptation to life stress, but more likely has to do with the circadian rhythm. Next, we tested the free forms of these hormones, estradiol. Her estradiol was good. I like it. Progesterone was low. And what happens is, and this happens frequently for women who are going through menopause, is progesterone usually dips first. So women end up getting in this estrogen dominant state. So we see that here. She has estrogen dominance because the ratio of progesterone to estradiol is low. We want to see this closer to 200. So usually hormonal symptoms happen because of this low ratio. So our goal is to get this ratio as close to 200 as possible by relieving symptoms. So it's looking like we're going to prescribe progesterone for her. Testosterone was good, DHEA was good. So let's jump over into her plan. The reason specifically why exercising will be important for this patient is to help control the blood sugar. Like I mentioned earlier, when you work those muscles become hungry for the blood glucose, and they'll take that glucose out of the bloodstream. Nutrition wise, let me grab my template for that. For her, we're actually going to have her do the most effective thing at getting your metabolism under control is we want to reset the metabolic set point. We want to change, like when you eat something, the receptors inside of your stomach, they get stretched and they sense whenever you're full. And they send a signal to the brain to say, okay, you're full, you don't need to eat anymore. But what has happened with a lot of people in our culture is those receptors get desensitized. So even though you're full, you think you still need to eat more. And I'm oversimplifying it. It's not just these mechanical stretch receptors. It's a whole slew of hormones involved. GLP-1 agonists are in the news now because of all the medications for weight loss. That whole mechanism involved with those medications is involved with this making you feel like you're not hungry anymore. It's involved in this whole process, just as a side note. But let me see, download. So the best way to reset your metabolic set point or to resensitize all those hormones and receptors is to start tracking what you're eating. You have to. I mean, I can't remember what I ate yesterday. How do you know? How do you know how many calories you're eating? How do you know if what you're eating is causing issues if you don't keep track of it? We need to, at least for a couple months, keep track so you just don't mindlessly eat. So tracking what you're eating, and I always have my patients use an app because it's so much easier with all these apps. They have good databases. So the one that I use is called MyNet Diary. There's MyFitnessPal. There's a bunch of other ones that you could use, but I'm gonna have her track what she's eating specifically to help her reset that metabolic set point. And then I always have I have a nutrition guide that I send my patients to. So I have her follow that nutrition guide, which is basically a whole food diet. That's going to help with the blood sugar. Something else to help with the blood sugar is berberine. It comes from a plant called Mahonia. It can help with the insulin resistance. So we're going to have her take berberine. So she was coming in mainly for hormone things, but incidentally she had those checked on there. So we're going to help her with that too. The blood sugar. But let's get this prescription down for the hormones. We're going to prescribe a vaginal estradiol. We're going to do a combo of estradiol, which is E2, and then estriol, which is E3. Estriol is a weaker form of estrogen, and we see it elevated in women who are pregnant. And then, so this is kind of like a lower dose of estradiol. What we want is we want that estrogen to just mainly take an effect locally in the vagina, because what that does is that will make the tissues in there more plump. When women start going through menopause, estrogen drops down, you get vaginal atrophy, which makes intercourse more painful, which causes vaginal dryness, which could also cause urinary issues. And then you're more susceptible for stress incontinence, meaning like you sneeze or you laugh and a little bit of pee comes out. But having a local vaginal estrogen in that area could help to build those tissues back up, help with vaginal moisture locally in the area. And then we're going to add in a progesterone. She was very low on progesterone, so I am going to actually prescribe the commercial one, which is still bioidentical. It's just the commercial strengths are only available in 2 strengths, 100 milligrams and 200 milligrams. Usually I'll prescribe compounded progesterone if I need to customize the dose, but hers is going to be 100 milligrams capsule. Take 1 capsule PSULE every night before bed. Capsule. Done. If you stuck around for this portion of the video, thanks for watching, and make sure you hit that subscribe button and hit the bell for notifications. See you guys in the next one.